We do a lot of hairline lowering surgery, as we call them halos, and I think it's also important to discuss the limitations of halo. And I'm speaking of the limitations of singular halos, meaning one surgery. How much advancement is possible? The main rule for doctors' work is primum non nocere, which means first and foremost, do not harm. So you have to respect the tissue. Don't advance everything so much as you think you can, and you don't really care what the tissue will do, because I'll tell you what happens. You can create necrosis, and we have a nice vlog on this on our YouTube channel. So don't excessively advance everything, push everything. There is a certain limitation of what tissue can take. Equally, limitations for halo is if you have a very broad, wide forehead. It has to do with this hair on the sides. This hair will not be changed by means of halo surgery. This is the main vector of advancement of your hairline. If you want to narrow this here, what is much better is if you actually have hair grafting with a skilled hair graft surgeon, because this hair needs to be implanted one by one. And the third aspect, which is equally something that you need to respect, is if patients have temporal recessions, high temples. Some women have an M-shaped hairline where this is going up, and they might even have very, very tight scalp, not a lot of laxity. So there's again some minimization of how much you can achieve, and if they're asking for a rounded hairline, then is something that I suggest to be a wonderful indication for a hybrid approach, where you do first hair grafting to fill out these kind of temporal recessions, and then we perform halo. So there are certain limitations of what you can do, and this is equally important as how powerful the procedure is in itself.